legitimate a fee raise in a couple of decades. You probably have some inflation in there you ought to adjust for. But then secondly, with regards to my health care plan, let me describe what I think is the ultimate conservative approach. In this country, you have today about 47 million people that don't have health insurance. We went out and tried to find out why they don't. We found out that about half of them could afford to buy insurance if it were reasonably priced. They could afford to buy it, but they weren't buying it. And we asked them why, and they said, well, why should we buy it? If we get sick, we can go to the hospital and get care for free. And we said, you know what? If somebody could afford insurance, they should either buy the insurance or pay their own way. They don't have to buy insurance if they don't want to, but pay their own way. But they shouldn't be allowed just to show up at the hospital and say, somebody else should pay for me. And so we said no more free riders. It was like bringing workfare to welfare. We said if you can afford insurance, then either have the insurance or get a health savings account, pay your own way, but no more free ride. And that was what the mandate did. It said you've got to come up with either the insurance or health savings account or alike. I think it's the conservative approach to make sure that people who can afford care are getting it at their expense, not at the expense of the taxpayers and government. That I consider to be a step towards socialism.